In Washington, lawmakers are pledging to do two things we haven't seen for years in Congress: move quickly and work across the aisle. But don't start counting your chickens just yet. A week and a half ago, Trump signed off on an $8 billion coronavirus spending package. And over the weekend, the House passed another bill specifically aimed at easing the financial burden on families, ensuring free testing for everyone, increased food assistance and unemployment benefits, and mandated sick leave for some. But the key word there is some, because the mandate only applies to the government and companies with fewer than 500 employees, which by the New York Times count could leave as many as 20 million workers uncovered. And while all but 40 lawmakers in the House voted for the bill, it's still unclear whether it will have enough support to make it through the Senate. Joined now by Congresswoman Katherine Clark, who's the sixth highest ranking Democrat in the House, has been a vocal supporter of the proposal. Congresswoman, it's good to see you. I don't understand why companies with more than 500 workers are not covered. Are they going to be less sick than people in smaller firms?
Well, they certainly should be covered, and we hope those corporations are going to do the right thing and focus on their workers and not their shareholders. But for this bill, we fought tooth and nail to expand paid family leave and sick leave for 87 million Americans. If we can get the GOP to go farther, we will welcome that.
What is their argument? I know that Mnuchin, Secretary of Treasury, was negotiating directly with the Speaker of the House, with whom you're close, Nancy Pelosi. What is their argument as to why bigger firms should not have the same mandate?
I think they feel that they don't want the taxpayers on the hook for large corporations. And that is all fine as long as they actually provide the benefits. Because what is important is that we don't have people feeling that they have to choose between going to work, potentially ill, and paying their bills at home. So, there's some indications now that the president may be looking to expand that. Certainly hope that's right. Certainly hope the Senate comes with a different attitude than we had in our negotiations and is ready to put Americans first.
Do you get a different, this is the most pathetically partisan time I can ever remember in my life. Do you get a sense that there's a different feel in Washington, at least at this moment, because of the breadth of this disease?
This disease doesn't care. Red state, blue state, who you vote for. And I think that some of these battles are going to be hard. Republicans have never supported paid sick leave. They don't believe in ensuring every single American. These are going to be tough-won policies, but this pandemic is bringing it into focus that these are critical pieces for the health and well-being of the American people.
But even though a quarter to a third of Americans, incredibly, are not covered by paid sick leave in this country, this is not a permanent expansion of it. This is purely for this crisis, is it not?
The GOP was very clear that this had to be restricted, and we're willing to accept those terms if we get relief to the American people quickly. This disease and the economic impact is not waiting for us. But I think it is the biggest expansion of paid sick leave that we've ever seen. It's going to be very hard when people start to see how much people rely on these good policies. These just aren't think tank policies.
To then take them away.
To then take them away.
So in 1 week, the president, this is just 3, you can get a test if you want it. Of course, you can't. The healthcare industry agreed to waive co-pays for treatment. In fact, they didn't. They waived it for testing. Google's putting up a website by Sunday night. Of course, they're not. I know you're not in the White House. Does the president just not get it? Or is he simply downplaying the severity? Less so today, but downplaying the severity because it doesn't suit his political needs. What's going on?
I think that the president is approaching this the way he approaches everything. This is a personal PR crisis for him instead of a public health and economic crisis for the American people. And I can tell you that we are trying to meet the insufficient response from the president with leadership and with action. When they proposed just $1.25 billion in new money, we came back with $8.3 billion. 11.6 of that came to Massachusetts today. and that's money for our frontline heroes who are going to help with this crisis. Then we went back and we did the Families First bill. We are in the process now of putting together the economic strategies that we're going to need to help small and large businesses get through this crisis.
A stimulus package of some sort.
That's right.
Mitt Romney, former governor of Massachusetts, as you know, essentially channeled Andrew Yang today. I don't know if you've heard this yet, but basically said he thinks such a stimulus should give $1,000 to every adult in the United States. Is that something the House of Representatives could buy into?
I think so. I think what we are hearing from economists and experts is that we are going to need that direct stimulus. What the amount is, how we exactly put it together. But we know where the Republicans started last week was a payroll tax cut. It is too long, it is too small an effect. We need to get money into people's pockets so they can pay those bills and stay afloat until we can get this disease under control.
Congresswoman, a constituent who likes you calls you on the phone and says, however, by shutting down my restaurant, I'm done. I can't take care of my workers who are like my family. 2, I don't know if I can survive 3 weeks, 4 weeks, 6 weeks of this. You and people like you may be well-intentioned, but you're destroying my livelihood. What do you say to them?
You know, I've been getting these calls. And they're very real for people.
What do you say?
Businesses they put together, now they're seeing crumble around them. And what I say is we're going to do everything we can to be there for you, to help you rebuild. But all of us have a social contract with each other. And we have to distance ourselves from one another to make sure we don't overwhelm our healthcare system. We know that our numbers, our trends are looking far more like Italy because this White House squandered the early weeks of this pandemic and by not having the testing widely available. So this is going to be hard. There are going to be a lot of hardships out there, but we have to work together and keep communities safe in order to be able to rebuild quickly.
Marty Walsh said a couple of minutes ago he can see this city, Boston, being totally shut down if we continue on the same trajectory. Can you see the country being totally shut down?
You know, I think it would be an extreme measure. I hope we don't get there. But we also have to make sure that we're doing everything we can to save lives. I think the measures that are occurring in Massachusetts make sense to me. We have to act now. You know, it's beautiful out today, but if we could see a huge hurricane coming, we would prepare. It's very hard for people when they don't know people yet who are sick, who have died, to understand the magnitude of what we're in. But I'm very grateful to our local and municipal leaders who do understand it and to the nonprofits that are stepping forward. And driving here, the streets were empty in Boston at rush hour. That means people are listening and doing everything in their power to help their neighbors.
We only have 15 seconds left. Mike DeWine, the governor of Ohio, would like the polling places to be empty of people tomorrow. Postpone the primary, the 3 others. Should they postpone the 4 primaries tomorrow for this reason?
You know, I think that is up to governors. If it is a health threat to have people gathering, then I think it's the right call.
Katherine Clark, thank you so much. Good luck, Congresswoman.
Thank you.